Okay. Good morning and welcome all my dear students. We are on the last point of the prescription chapter. And as per our rule of lectures or sessions, we revise what we have covered in the previous lectures. And let's finish today's topic, that is errors in prescriptions, errors in handling of the prescriptions, whatever the errors, whatever the mistakes done by pharmacist, done by physician, registered medical practitioner, what are the errors we can face and how we can overcome these errors, that we are going to learn in this point of prescription chapter. So before that, whatever we have covered till date, till now in prescription chapter, let's revise it in a very short manner and in a quick way. We are going to revise this prescription chapter, understand? So let's start with the contents of this prescription chapter. In that, we have finished introduction, parts of prescription, types of prescriptions, legal requirements for valid prescriptions, and handling of prescriptions, and abbreviations also we have finished in the uh, last lectures. Okay, and in today's topic we are going to finish, as we said, that error in prescription that we are going to discuss on this point in this chapter. But as the slides goes on, you just revise whatever we have explained regarding the prescription. Okay, this is the introduction of prescription, which is derived from the Latin term, and prescriptors, it is of two combination of two words. It means have to write before. Then it is the definition, it is a written order by a physician, dentist, veterinarian, or registered medical practitioner to pharmacist, or to compound and dispense specific drug for the patients. Okay, and we said that pharmacist is the intermediate between physician and patients. Okay, then we have the parts of prescription, and we discussed 9 parts of prescription, important, and each and every part is having its place in that prescription. So the first we have seen the physician or prescriber office information. In that, office name with address, email ID, phone number, that should be, and prescription number, that is have to be mentioned on the prescription. We said that. Next part is the date, how date is very important. Also we have discussed in the last lectures. Then patient information, what type of patient information should be included in prescription, that also we have discussed in the last lecture. Name, age, sex, and address of the patient having important role in the prescriptions detail. Okay, to avoid misusing of narcotic drugs, to identification of the patient, that is important in the patient information. Okay, then we have fourth part of prescription is superscription, which is denoted by the symbol Rx, which means take thou, receive, you take. Okay, and this is the symbol is considered as the sign of Jupiter, which means Jupiter is a Greek god of healing, and it is a prayer requesting to the god for quick recovery of the patient. Okay, and next inscription that we called, it is the main part of the it is the main part of the prescription, and it contains the name and quantities of the prescribed medicines, prescribed medicaments, and in that official preparations and non-official preparations also we have explained. Then we have subscription part, number of doses, and whatever the direction to the pharmacist is mentioned in the subscription. Then signaturized direction to the patients, by which route doses form have to be taken, how many times, that should be directed to the patients. Okay, and renewal instruction is also there. If the in the habit forming drugs, to prevent the renewal, to prevent the misusing, these renewal instructions are written by the physicians in the prescriptions. Then at last part of this prescription is prescriber signature with his registration number for valid prescription, legal prescription. For that purpose, this included in the parts of prescription. Then we have the types of prescription. We have compounded prescription and non-compounded. Compounded prescription is also known as extemporaneous. In that, we have seen
Mixing of one or more ingredients have to be performed by the pharmacist. Compounding is have to be done by the pharmacist and dispensed to the patients. And non-compounded prescription is do not require compounding of pharmaceutical product. Just pre-compounded drug have to be dispensed by the pharmacist to the patient. That is the non-compounded prescription. Then we have legal requirements for valid prescription, and in we have discussed many points regarding the validity and the legal requirement of the prescriptions. Okay. And this is the example of prescription format that you have to understand what type of prescription and which part is known as the uh, of prescription, that we have seen through the picture also. Then these are the some Latin abbreviations which are used commonly in the prescriptions, which have to be familiar with the pharmacist. But as said that abbreviations are not to be allowed to be used, not allowed manyapeksha, it is said to be, it is not used for a better understanding of the prescription by the pharmacist. Then we have the handling of prescription, and we discussed 4 points of handling of prescriptions. In that, 4 points are receiving, reading and checking, collecting and weighing the materials, compounding, packaging, and labeling. In that, we have discussed how the pharmacist should receive the prescription. He do not change his or her facial expressions while receiving the prescriptions. We said that. And reading and checking, how to read the prescriptions and what to check the prescription, also discussed in the last lectures. Then collecting, weighing, and material, how collection of the materials for required for the compounding purpose, uh, how it taken, and it has to be kept at left hand side, and after measuring, weighing, it is transferred to the right hand side for the confirmation of collecting and weighing of the materials. Okay, that should be. And checking purpose and for compounding, packaging, labeling, that also discussed in the last lecture. And care required in dispensing prescription also we have looked out in this last lecture. Okay. And this is the abbreviations. It is nothing but it is the errors. These are the errors. Heading is remain here. So you have to understand these are the errors in prescriptions. Okay, these are the errors in prescriptions. This is the today's topic. So till now we have completed the revision, and now we are going to start our today's topic, last part of this chapter, prescription. And in that we are going to learn, discuss errors in the prescriptions. And the first error is found with the abbreviation. The first error is what? Abbreviation. Abbreviation तुम्हाला माहित आहेत की most of the doctors write the abbreviations, but in most of the prescriptions abbreviated terms are used by the prescriber that leads to major errors during interpretation by the pharmacist. Okay, this is the confusion. And why these people are saying that don't use abbreviations? While because it creates the errors during interpretation by the pharmacist in the understanding reading of these abbreviations by the pharmacist. The example is given here, SSKI. SSKI is the abbreviated term of saturated solution of potassium iodide. Okay, SS saturated solution and Ki is the potassium iodide. It is preferable to avoid these types of misleading abbreviations. आता SSKI हे सगळ्याच फार्मासिस्टला इंटरप्रिट करता येईल किंवा नाही, किंवा SSKI is the official abbreviations or not, it is not confirmed. But if doctor prescribes SSKI, what is it means? If the pharmacist has enough knowledge, then he will understand saturated solution of potassium iodide. But if the pharmacist is unaware, if the pharmacist don't have enough knowledge, at that time pharmacist read as SSKI. SSKI means what? He is not going to understand anything. And if he do not understand anything, then how he should compound the medicines to the patient? त्याला प्रिस्क्रिप्शनच जर कळला नाही तर तो पेशंटला काय देईल? Understand? So abbreviations are the one type of errors in the prescriptions, and that should be avoided by the physician, he has to write the detail or complete name of SSK as saturated solution of potassium iodide. Understand, my dear students, how these abbreviations create a problem in prescriptions. So this is the first error, that is abbreviation. Understand? Next is the name of drugs. Second error in prescription is name of drugs. आता name of drugs काय आहे? Name of some drugs, especially brand names. Brand names जे डॉक्टर प्रिस्क्राईब करतात, काही औषधांची नावं अशी आहेत की त्यांचं स्पेलिंग किंवा त्यांचं साऊंड, प्रोनाउन्सिएशन ज्याला आपण म्हणतो, ते जवळपास सारखं वाटतं, पण वेगवेगळे असतात. बट in pronunciation or in spelling, in looking, they are looking same. Okay, that's why these name of some drugs either look or sound alike. Alike म्हणजे सारखे, सारखं साऊंड करतात किंवा दिसतात सारखे. So any error in the name of drug will lead to the major danger to the patients. For example, althrocin and iltroxin, this is the sound same like, but these two drugs are different, their functionalities are different, but they sounds like same. Althrocin, iltroxin, acidin, apidin, digoxin, digitoxin. Okay, it looks sound कसा येतो याचा सेम आहे, बट रायटिंग मध्ये तो जर डिजिटॉक्सिन लिहिला असेल, and if pharmacist read it as digoxin, or acidin लिहिला असेल, apidin वाचलं, apidin लिहिला असेल, acidin वाचलं, iltroxin लिहिला असेल, althrocin वाचलं, किंवा दिसायला जरी सारखे आहेत. आणि ह्या कन्फ्युजन मुळे ह्या नेम्स ड्यू टू द सेम or sound alike names of the drugs, which creates the error in the prescription in understanding. And if a person given instead of one drug given another drug, it will hamper, it will harmful to the patient, it will create, it will lead to the major danger to the patient. That's why the name of drug should be written very well, and the spelling of the drug has been prescribed very clearly in the prescriptions. Understand? This is the second error in the prescriptions. Third error, that is the strength of preparations. Strength of preparations, as per the name suggests us that strength of preparations, जे काही डोसेस फॉर्म आहेत त्याचं स्ट्रेंथ, त्याचा डोस किती आहे. फॉर एक्झाम्पल पॅरासिटामॉल आहे तर 500 मिलीग्राम किंवा 650 आहे किंवा 100 200, वॉट एव्हर द स्ट्रेंथ ऑफ द प्रिपरेशन्स, दॅट विल क्रिएट एरर. आता हाऊ दिस स्ट्रेंथ ऑफ प्रिपरेशन विल क्रिएट द एरर? स्ट्रेंथ तर प्रत्येकाला लिहावीच लागते, तरी पण स्ट्रेंथ ऑफ प्रिपरेशन आपल्याला कसं एरर क्रिएट करेल त्यामध्ये हे आपल्याला सांगणं कठीण आहे. सो द ड्रग्स आर अवेलेबल इन द मार्केट in various strengths, so the drug must not be dispensed if the strength is not written in the prescription. For example, if the doctor write only paracetamol 500 milligrams should not be dispensed when no strength is mentioned in the prescription. Understand? म्हणून strength of the preparation is compulsory to write by the doctor on the prescription. समजा फक्त पॅरासिटामॉल लिहिलेला आहे, मग काय समजायचं फार्मासिस्टनं? 250 mg ची द्यायची, 500 mg ची द्यायची, का 650 mg ची द्यायची? सो स्ट्रेंथ ऑफ प्रिपरेशन create the error in the compounding and dispensing of the prescription, and that's why the strength of preparation compulsory to write, compulsory to mention on the prescription. Understand, my dear students? This is the third error in the prescription. First error कोणता होता? फर्स्ट एरर होता अब्रिवेशन. सेकंड एरर कोणता होता? नेम ऑफ द ड्रग. थर्ड एरर कोणता आहे? स्ट्रेंथ ऑफ द प्रिपरेशन्स. ओके, 3 एरर आपण पाहिले. दिस इज द फोर्थ एरर, that is communication failure. Communication failure, failures during the process of patient management. It includes illegible handwriting, incomplete prescribing order. Common errors includes G mistaken for mg, means कॉमन एरर्स इन्क्लूड जिथं ग्राम लिहायचं तिथं mg मिलीग्राम लिहिलं आणि जिथं मिलीग्राम लिहायचं तिथं ग्राम लिहिलं. G फॉर ग्राम आणि mg फॉर मिलीग्राम. सो दिस इज द कम्युनिकेशन एरर. इलिजिबल किंवा इलिजिबल म्हणजे नॉट एबल टू रीड such type of handwriting of the prescription by the doctors. तुम्ही आतापर्यंत असे भरपूर प्रिस्क्रिप्शन पाहिले असते, वाचूच शकत नाही आपण डॉक्टरनं काय लिहिलंय ते. अंडरस्टँड? सो that communication failure, communication errors should be avoided in the abbreviation, in the errors in the prescriptions. How we can avoid such mistakes, communication failure? By using computerized typed prescriptions. In that there is no chance to mistake in the spelling, illegible handwriting. There is no question arised in that if the prescription is computer based. Okay, so this is the fourth error in the prescription. Next is the dosage form of the drug prescribed. Dosage form काय असतं? सुटेबल फॉर्म ऑफ ऍडमिनिस्ट्रेशन, म्हणजे टॅबलेट आहे, कॅप्सूल आहे. जर डॉक्टरने त्या पेशंटला सांगितलंच नाही टॅबलेट घे, सिरप घे, सपोजिटरीज घ्या, वॉट एव्हर द डोसेस फॉर्म, कॅप्सूल आहे, वॉट एव्हर द डोसेस फॉर्म has been not mentioned in the prescription, it is hard to give by the pharmacist. Many drugs are available in more than one dosage form. Understand? पॅरासिटामॉलची टॅबलेट पण आहे, पॅरासिटामॉलचं सिरप पण आहे, पॅरासिटामॉलचं इंजेक्शन पण आहे, पॅरासिटामॉलचे सपोजिटरीज पण आहेत. ओके, सो मेनी ड्रग्स आर अवेलेबल इन मोर दॅन वन डोसेज फॉर्म. For example, liquid, tablets, injections, or suppositories, and the dosage form intended for the patient must be mentioned in the prescription to reduce ambiguity, to reduce confusion, to reduce errors. It is important to write the dosage form: tablet, capsule, injections, liquid, syrup, elixir, whatever the dosage form necessary or compulsory to prescribe by the doctor, prescribed to be mentioned in the prescription. Understand? This is the fifth error in this prescription, that is the dosage form of drug prescribed. Then dose is the error, and it is the important one. If unusually high or low dose is mentioned in the prescription, then it must be consulted with the prescriber. Sometime a sustained release dosage form is prescribed thrice or more times daily. Actually, sustained release dosage form should be given once or twice a day. Okay, it should be understood by the pharmacist. डोस किती आहे? लो डोस, समजा एखादा पेशंट कमी एजचा आहे किंवा ओल्ड एज आहे, इन्फंट आहे, चाइल्ड आहे, किड आहे, ऍडल्ट आहे, जर त्याच्या एज नुसार त्याला जर डोसिंग दिलं नसेल तर देन द थेरपेटिक इफेक्ट इज अनेबल ऑन दॅट पेशंट. ओके, थेरपेटिक इफेक्ट जो आहे त्या ड्रगचा तो पेशंटला मिळणार नाही, आणि त्याच्यामुळे त्याच्यावर जो काही ड्रगचा इफेक्ट आहे तो होणार नाही, आणि त्याचं जे इन्फेक्शन आहे, डिसीज आहे, तो कमी नाही होणार. म्हणून डोस, रिक्वायर्ड डोस, नुसतं डोस म्हणण्यापेक्षा रिक्वायर्ड डोस इज इम्पॉर्टंट टू मेन्शन इन द प्रिस्क्रिप्शन बाय द डॉक्टर. ओके, समजा काही वेळेस सस्टेन रिलीज टॅबलेट कॅप्सूल असतात. सस्टेन रिलीज म्हणजे एक टॅबलेट घेतली ना की त्याचा इफेक्ट हा 12 तास, 18 तास, 24 तासासाठी सुद्धा राहतो. जर असे टॅबलेट जर 3 वेळेस दिवसातून जर प्रिस्क्राईब केले, जसं की गरज नाहीये, किंवा एक टॅबलेट किंवा 2 टॅबलेटची गरज असते, त्यावेळेस जर तुम्ही 3-3 टॅबलेट प्रिस्क्राईब करत असाल तर त्यावेळेस सुद्धा ओव्हरडोस होण्याचे चान्सेस असतात सस्टेन रिलीज डोसेस फॉर्म मध्ये. त्यावेळेस सुद्धा फार्मासिस्टने हे एरर्स आयडेंटिफाय करायला पाहिजेत आणि डॉक्टरशी, फिजिशियनशी डिस्कशन करून, चर्चा करून द डोसेस वाढवले पाहिजेत किंवा कमी केले पाहिजेत बेस्ड अपॉन dose. If the dose is low dose, then pharmacist will have to be increase the dose. If it is overdose, then pharmacist, after discussion with the doctor, decreases the dose for the patient. Understand? This is the 6th error in the prescription. Then instructions to the पेशंट समटाइम्स इन्स्ट्रक्शन दिलेले असतात की दुधासोबत घेऊ नका किंवा विथ मिल्क हे औषध घ्या किंवा नाकावाटे घ्या तोंडावाटे घेऊ नका. सच इन्स्ट्रक्शन्स सिग्नेचर ज्याला आपण प्रिस्क्रिप्शन मध्ये म्हणतो ते सिग्नेचर पेशंटला कन्फ्यूज करतात. ओके, किंवा सांगून पण पेशंट भरपूर वेळेस विसरतात. 3 वेळेस घ्या म्हणले की 2च वेळेस घेणार, एक वेळेस घ्या म्हणले की त्याला 3 वेळेस घेणार. Such type of common mistakes are possible regarding the instructions to the patient. Sometimes the instructions for certain preparation is either omitted or mentioned partially. The route of administration should be mentioned clearly. Okay, route of administration should be mentioned clearly by the doctor in the prescription. So it is important. So it is very necessary to give the instructions to the patient by the doctor or pharmacist, and it will avoid the errors regarding the instructions. Then incompatibilities. Incompatibilities are nothing but when two drugs are mixed together. Understand, drugs मध्ये सुद्धा रिॲक्शन होत असते आणि डॉक्टर आपल्याला एकच औषध प्रिस्क्राईब करतं का, एकच ड्रग प्रिस्क्राईब करतं का? प्रिस्क्रिप्शन मध्ये 4-5 नमुन्याचे ड्रग्ज अवेलेबल असतात, हो ना. जर ते ड्रग एकमेकासोबत आपण काय करतो, सगळे औषधं एकानंतर एक खातात पेशंट, आणि त्यावेळेस जर एखाद्या वेळेस जर इनकम्पॅटिबिलिटीज झाले किंवा ड्युरिंग द फॉर्म्युलेशन्स सम इन्ग्रेडियंट्स आर नॉट सुटेबल विथ इच अदर, म्हणून आणि त्याच्यामुळे जर 2 ड्रग मिक्स केले असतील तर एक हार्मफुल प्रोडक्ट तयार होतो, अँड दॅट इज नॉट वेल फॉर दी पेशंट हेल्थ. त्यालाच म्हणायचं इनकम्पॅटिबिलिटीज. इनकम्पॅटिबिलिटीची डेफिनेशन काय? when 2 or more drugs are mixed together, a harmful product is formed which is dangerous to the patients, and it is essential to check that there are no pharmaceutical or therapeutic incompatibilities in the prescription. If more than 2 medicines are prescribed, then it is duty of pharmacist to see whether their interaction will produce any harm to the patients or not. For certain drugs have interaction with food सोबत काही ड्रगच्या इंटरॅक्शन असतात. फॉर एक्झाम्पल टेट्रासायक्लिन नावाचं ड्रग हे दुधासोबत अवॉइड करायचा असतो. शुड नॉट टेकन विथ द अँटासिड और मिल्क, अदर इट विल क्रिएट द येलोनेस इन द टीथ, येलोइश टीथ बनवतं हे. दुधासोबत जर हे टेट्रासायक्लिन घेतलं तर किंवा अँटासिड सोबत घेतलं तर इट विल हॅव दी yellow coloration on the teeth. That's why, and that is the incompatibilities. And if the tetracycline is taken with the milk and prescribed such like that, pharmacist will have to change such type of instructions. Okay, so this is the 8th and last errors हे 8 आहेत. कोणकोणते? इनकम्पॅटिबिलिटीज, instructions to the patient, doses form, communication failure, strength of preparation, name of drug, and abbreviations. Understand, my dear students? So these are the errors in the prescriptions and labeling of the dispensed medicines. Okay, so this is the label of the prescription that is not for us, and in this way this is the end of the prescription chapter. And next chapter in the unit 1, that is posology, we will start in the next lecture. If any students have any problem regarding the prescription and the name of book from, you have to read this prescription. I already told in the last lecture. R.M. मेहता नावाचं पुस्तक आहे डिप्लोमाचं, त्याच्यामध्ये हे प्रिस्क्रिप्शन अगदी सोप्या भाषेमध्ये तुम्हाला समजेल या भाषेमध्ये दिलेलं आहे. आणि माझं प्रेझेंटेशन तर मी गुगल क्लासरूमवर आज अपलोड करेनच. व्हॉट एव्हर द प्रिस्क्रिप्शन, ते सुद्धा तुम्हाला रेफरन्स म्हणून वापरता येईल, आणि R.M. मेहताचं पुस्तक पण तुम्हाला वापरता येईल. अंडरस्टँड? सो इफ एनी स्टुडंट्स हॅव्हिंग एनी प्रॉब्लेम, राईट your question in chat box. I will discuss and try to answer your questions. Okay, if any problem if you have, then write.